Hello, welcome everybody. This is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine, certified by the American Board of Internal Medicine. If you are new to this channel, then definitely consider hitting the subscribe button below and switch on the notification bell so you don't miss any new videos that I post. For my subscribers, thank you for your continued support. Today, I'll talk to you about cardiac arrest in athletes. Sudden cardiac arrest and death associated with athletic activity is a rare but devastating event, as the athletes are young and are apparently healthy. While these cardiac arrests and deaths are unexplained, a large number harbor underlying previously undiagnosed heart disease. The majority of sudden cardiac arrest events in athletes are due to malignant irregularity of heart beating, usually due to ventricular tachycardia or ventricular fibrillation. Ventricular tachycardia is a type of abnormal heart rhythm and occurs when the lower chambers of the heart, the ventricles, beat too fast to pump well and the body doesn't receive enough oxygenated blood. Ventricular fibrillation is similar, but the heart beating is fast and irregular in a chaotic manner. In individuals with certain cardiac disorder, athletic activity increases the likelihood of ventricular tachycardia and fibrillation. It is widely accepted that sudden cardiac arrest and death is one of the leading medical causes of death in athletes, with an incidence between 1 to 50,000 and 1 to 100,000 per year in young athletes. This rate is notably higher in old adults over age of 35, with an incidence closer to 1 in 7,000 healthy athletes per year. Male athletes are at greater risk, and there appears to be a disproportionately higher risk among male African American athletes. The heart abnormalities that predispose to sudden cardiac arrest in athletes include: number 1, structural heart disease. Sudden cardiac arrest in athletes often occurs in the presence of structural heart disease, although the underlying disorder is usually undetected until presenting cardiac arrest. Structural heart disease can increase the risk of sudden cardiac death as athletes develop ventricular tachycardia or ventricular fibrillation. Less common causes include blood shunting from the right to the left side of the heart in patients with congenital heart disease or dissection of the arteries. In athletes less than 35 years of age, the commonest structural heart disease is hypertrophic cardiomyopathy, a disease caused by abnormal genes that cause the heart muscle to grow abnormally thick, especially the muscular wall, the septum, between the two bottom chambers of the heart, the ventricles. Other causes include anomalous origin of coronary arteries, arrhythmogenic right or left ventricular cardiomyopathy, myocarditis, which is inflammation of the muscle of the heart, and coronary artery disease. In athletes more than 35 years of age, the so-called masters athletes, coronary artery disease is the predominant cause of sudden cardiac arrest and death during exercise. 2. Primary electrical disease. Sudden cardiac death during athletics also occurs in the absence of structural heart disease, a situation termed primary cardiac electrical disease. A number of inherited arrhythmia syndromes predispose individuals to sudden cardiac death, and heart is usually structurally normal in these patients. Examples include long QT syndrome, Brugada syndrome, catecholaminergic polymorphic ventricular tachycardia, short QT syndrome, and early repolarization syndrome. The arrhythmic events may be precipitated by trauma or occur as sporadic phenomena, such as commotio cordis, in which sudden cardiac arrest and death results from being struck in the chest wall with a projectile object such as a baseball, hockey puck, or fist. 3. Myocarditis. This is inflammation of the muscle of the heart and has been reported in about 7% of cases of sudden cardiac arrest in competitive athletes and 20% of military recruits. This is particularly important at the current time of COVID-19 pandemic, as the COVID-19 virus can cause inflammation of the muscle of the heart and the individuals can be asymptomatic. The diagnosis of myocarditis is most often suggested by clinical findings of heart failure in an otherwise healthy young person, ECG signs, and regional or global wall motion abnormalities on cardiac imaging. Active myocarditis is associated with ventricular tachycardia and fibrillation and sudden cardiac death. Athletes who are at risk of sudden cardiac death due to structural heart disease or primary electrical abnormality, participation in athletic activity depends on several factors, including baseline fitness level, the nature and intensity of the athletic activity, the presence and extent of cardiac disease, and the psychological and physical benefits from sport. Although there are exceptions, for most individuals, the overall benefits of regular exercise far outweighs the risks. Athletes with conditions that result in cardiac arrest in the presence or absence of structural heart disease generally are treated with an implantable cardioverter defibrillator, abbreviated as ICD, and have traditionally been counseled to not participate in any moderate or high-intensity competitive sports. An AICD is a battery-powered device placed under the skin that keeps track of the heart rate and rhythm. Thin wires connect the ICD to the heart, and if ventricular tachycardia or ventricular fibrillation is detected, the device will deliver an electric shock to restore a normal heartbeat. ICDs are very useful devices in preventing sudden cardiac death in patients with known ventricular tachycardia or fibrillation. Athletes with ICD and who have had no episode of ventricular tachycardia or ventricular fibrillation requiring device therapy for 3 months may engage in competitive sports with an understanding of the potential risks involved. If you have any question about what I presented to you today, then subscribe to my channel and share your question in the comment section below and I will reply to you. If you have a question that you would not like to share in public, then follow me on Twitter at Dr. Bolad and then send me a private Twitter direct message and I will reply to you. If you found value in this video, then please like and share this video with family and friends. This is Dr. Bolad, helping you with your heart health. Thanks for watching and talk to you soon.